FM Drive.
And thank you for joining me, Gordon T, here on Hope FM Drive. And it's my honour to bring to the show for the second time BJ Waltho. BJ is the Associate Director of Operations at University Hospitals Dorset Foundation Trust. Hey BJ, how are you doing?
I'm doing very well, Gordon. Thank you very much for asking.
Well, it's
and yourself?
Great.
How are you?
Oh, thanks, Oscar. I'm pretty good, all things considered. Thank you very much. Actually, yeah, it's not affecting me too badly. I've been doing this remotely right since the first lockdown started, so in that situation hasn't changed for me. But I can imagine since when we last talked, because you were last on the show, we'd come out of the first wave. It was probably sort of July time, something like that, and things were looking reasonably positive at that point. And you've been through a horrendous situation in hospital. You'd done an amazing job, and we were all very grateful for that. And then we've had a bit of a lull, and now things look like they're not where we would like to be. I think would be a fair way to describe it, looking from the outside. Can you tell us a little bit about how things are going at the hospital? Has your job title changed?
My what?
Your job
My
title?
job title?
Associate Director of Operations of the University Hospitals Dorset Foundation Trust.
Oh, yes. Well, of course, since we last talked, we've merged with Poole Hospital. So we're now one, although we're two sites, well, three sites actually, because we've got Christchurch, we've got Bournemouth site and Poole site. So we are one big organisation now. So there we go. So, I can report on two sites now and not just one site. But although I'm based specifically at Bournemouth site, but we are now in very close contact with our Poole colleagues many hours, most days, because we are one big trust.
So coordinating across the two to serve us as well as you can. Yeah. So the rate at the moment, in the last, talking about COVID, obviously, in the last week, there's been 809 cases around our area. And if I was to compare that to the start of COVID to July, well, that's more. We've got more just in the past week than in the whole of that period previously. But in that period from sort of March through to July, there wasn't as much testing. So in the hospital itself, what's it look like at the moment? Are you seeing more people arriving?
Yeah, so at the latest figures that we get obviously very regularly and have only just come out in the last half an hour, we've got 74 patients currently admitted across both sites. On the Royal Bournemouth site, we have 15 on our wards, and one of which, and plus one in ITU, and the remainder of those, so quite a few, if you do your calculations right, there's 59 COVID positive patients at Poole with 5 in their ITU, so they've got quite a lot more COVID than we have on this site at the moment. So it is busy, you're absolutely right. I think that it's going to get busier because it's the youngsters that got it first at this time, but we are seeing some data that shows that it's shifting into our older population, and of course our older population have got what we call comorbidities, i.e. they've got other underlying conditions. So the youngsters, when they get it, on the whole, and I don't want to generalise too much, cope with it a little well. It knocks them for 6, but they don't need admission so much. But as you get it, if you're older, you're likely to be hit much harder with it. So we are anticipating quite an increase in the next couple of weeks as it shifts to our older population. And we're preparing for that at the moment. We've, dusted off. During COVID, the first COVID, it was a brand new experience to us. So it was very much a learning exercise in the sense that we had to develop procedures and policies to do with this new world. Now we've got those policies and procedures all in place, so our efforts are really, focusing on, what did we learn from last time, and are those policies and procedures still fit for purpose? But we've got to be here for our patients, as you say, because the numbers out there are growing, and there are more being tested. You're absolutely right, and that's what's throwing the data out a little bit. That more, the track and trace, and people isolating, and people knowing they've got it that perhaps they didn't before, because they can get tests that much easier. Well, not for some people, but they're more readily available. So it is a concern for us, but we're really, really lucky that we've got the plans that we can bring into action again. And the teams here, we all learnt so much last time, and there we go.
I like the fact that you say that obviously you've learnt so much in lessons from the first time round to be able to prepare for it. Do you feel you've got enough support and equipment and funds to be able to cope with the potential flood that might come?
Right. I will say that funds have never, ever got in the way, because we're very fortunate in that is what we don't let funds get. We'll talk about our overdraft at the end of the year, what we need for patients now, but we did get a lot of equipment during phase one, and so that equipment's still here. So additional ventilators, additional monitors, additional pumps. What the biggest issue in the country is actually staff. So people will say, I can see, the people who don't believe in COVID will say, I see empty wards. But those empty wards will be because there's no staff to be able to nurse them. So that is always a fine balance for us about being able to nurse and care for patients safely without just opening extra beds, because we can all buy beds. We could go down to Beds R Us or Dreamworld, whatever it's called, and get beds. It's actually being able to safely manage those, especially those ones that go into ITU, because it is a very skilled job to look after those. So that's always a dilemma. And, our director, our chief nurse, and her deputies are always looking at how we can manage these patients safely. We've not got an issue at the moment, but it is reviewed twice a day, what our levels are and what care we can give them. But equipment isn't an issue. Funding, we're always seeking. It would be the staff to be able to nurse these patients.
Well, that is a challenge to balance all the different bits, then, isn't it?
Yeah.
So, and get the right staff at the right times.
It is, and of course, what we've always got to remember is we always talk about the number of people with COVID or isolating. Well, nurses, doctors, physiotherapists, admin people are all people as well, and actually we get it. And that's the issue, is it doesn't just affect the general public. We are members of the general public, so it affects us too. So we do lose people to taking time off because they're being, have to self-isolate or quarantine too, which affects us in our ability, to manage. We do manage. I mean, it's not been an issue to date, but it's something that we must never forget. But I don't want people not to come in, because we are managing, and we have managed, and we will manage. The difference perhaps this time, though, Gordon, is that we had a real issue with turning everything off last time. All those elective patients, and I think I discussed that last time with you. All those patients who were waiting on a list for an operation. This time we haven't done that. So last time we had those staff available to support us. At this time, we've recognized that some people have been waiting ages for their operation. So we are currently, on both this Bournemouth site and the Poole site, are doing everything we can to keep those operations going and those people treated for the conditions that they've got. So that is quite a big difference compared to the first time. Now, whether we can maintain that if the numbers go up and up, because that may not be possible. But again, that's something we're reviewing, because we recognise that, that it is bad. To wait a year for an operation is not nice, especially if you're in pain. So that's a real change this time, that we've kept on with all those theatres, all those investigations, all those clinics that we pulled the plug on because we thought that was right last time.
And is part of that also because you understand COVID a bit better, so you're able to protect those areas more effectively, or is it simply about staffing?
No, it is. It is that we understand it more. We understand it, but we also understand that we can do all the emergency stuff. But actually, we must never forget that poor patient who's at home in pain, and they are just as important. And trying to maintain those two, whilst we can, is I think our biggest challenge, our biggest aim. That is what we're aiming to do, because that is, I just can't we have to keep going for those patients. So we are, it's pushing the staff. There's no doubt about that, because we haven't got those staff that we had last time. But that's what we do. That's why we come into healthcare, because we're here for our patients. So we will keep on doing it. There we go.
Well, thank you very much for all you're doing and all that you guys are going to be doing. Just looking at the figures again for a second. So in our area, we've got 205 cases per 100,000 people in the last week.
Yeah.
And the average in England is actually 156. So we've almost got an extra 33% compared to the average. And you mentioned about young people seem to catch it first, and then it's passing into the elderly population.
Yes.
So obviously all the students came back. I'm not blaming students or anything like that, but
no.
I do think that perhaps people assess it differently according to their own perceived risk for themselves. And I'm also very aware that there are people who are still contacting me going, the whole thing is just a conspiracy and it's a fake. And
I know.
I'm like, how on earth are people still saying these sort of things? I just wondered if there's something that you would like to say about what you've seen, your experience, that maybe for those people who are still doubting it's real, might encourage them at this time during this lockdown to maybe act a little differently.
Yeah, it is interesting, because the general public can really help the NHS cope with this. Follow the rules. Just please follow the rules. And, I don't want anybody ever to go through what some of these patients suffering from COVID, and I'm not talking about those poor patients who have died, of which we've had some, as you know, but it's even, fighting for your breath is the most horrible thing you can ever experience. And when you see that, I mean, I wouldn't want anybody who's not gone through that to see it, because it is really, really hard. So I don't know how we can ever change the mind of these disbelievers, because I think that's they are. But I really want to encourage the general public to follow the rules, that we've set out with closures and, not going around if you don't have to. And also today, it's quite timely that you're talking to us, because we've launched today our new visiting restrictions. So we've brought in new visiting restrictions similar to those that we had during the height of COVID, for exactly that reason. Obviously, those people visiting people end of life, or those people with special needs, we will adapt the rules, but we are absolutely restricting visiting from tomorrow as we go into lockdown, and that's what I'm asking. Would I rather they clapped me or followed the rules? Please follow the rules. I think all healthcare professionals, it was nice to be clapped, but please just do as you're being asked, because that it will do more to help us than any clapping. So, I mean, the other thing is that I really perhaps want to say, Gordon, is I think it's affecting people's mental health, and some of our older population who've been in lockdown for ages, or what it feels like for, and even young people, if it's affecting their mental health, then please speak up about it. Please seek help. So that's something else I think the general public can do to help us, is when if they know of people who could have support, those lonely people next door to you, just a simple phone call. We don't want you going in to see them, but a simple phone call, or asking them when you do your online orders, anything you can do for those few words, phoning people up you haven't spoken to in some time, because people do need to speak up, because this is hard going for our whole nation. It's hard going for people in the healthcare, but you know, it's about, we're in this totally together. We have to do it, but don't be frightened to speak up. Don't be frightened to ask for help from any. You know, there are people out there to say, I've always got an ear. You know, do that. If you're a member of the public out there and you don't mind people having a chat to you or feeling down, anybody you think is vulnerable, then give them a call. That will do more to help us in the long run, and help our, you know, people with small business. I'm rambling, aren't I?
It's fine. You're saying good stuff.
But people with, you know, who are small businesses who are having to close yet again. People working in hospitality who don't know, you know, how they're going to pay the mortgage next. You know, anybody you know in those circumstances, giving out a little help to them will help us, help our nation in the end, if we're all there to support one another. So that's my plea. Is that an okay plea, Gordon?
I think it's a very wise and timely one, so I'm really grateful to hear it, and I'm sure many of your listeners right now will be nodding away, supporting you and thinking, yes, absolutely, and I'm hopeful that those people who previously might have been maybe not worrying about it and think I'll just carry on doing whatever I like, I hope that they'll maybe think about that again, having heard about the situation that you've been through and the preparations you're having to make for what may come. And I think it'd be fair to say that on behalf of everyone here at Hope FM as well, we just want to wish everybody at the hospital the very best. We really appreciate you guys, all you're doing. I've got to say hats off, because I know people who work in the hospital, and I know the things that they've been through, or some of the things they've been through, and I'm just grateful there are so many people who are willing to serve in such tiring and difficult circumstances.
Yeah, and that's really appreciated, and I will get that message sent out. But we have learned from last time. So we have learnt, for example, exactly about our BAME colleagues, our colleagues from overseas. That took us a couple of months to recognise nationally. Now we know. So now we can put those things in place to help protect them more. So there is a lot of learning. You know, I am much more confident about it and our ability to deal with it, because we recognise it so much more now than we did. And that sounds like, no, because I say it was a learning for us. It wasn't that we weren't cognizant of it, but it was a steep learning curve. Whereas now I believe, you know, we've got that in place, and we can, you know, direct. We know now that the elderly, you know, once if they get it, there will be. Although my dad went in, he's 88. He went in 4 days later. Well, there we are, home again. We never thought we'd see him again. He got, yeah, impressive, isn't it? So there is always, as we would say, hope. Never give up hope, because that's what
absolutely.
We've got. And but it's nice, and if everybody does their bit, we can get through this once again. We will get through it. We will, and we will all be able to have a nice Christmas, I hope. Let's that be our aim, for us to all have a lovely Christmas. Yeah.
That is a great aim. BJ, thank you so much for updating us on the situation there at the Bournemouth and Poole hospitals. Gordon. We will look forward to hearing from you in due course, and I hope that everything goes smoothly for you in the hospital as best as it possibly can under the circumstances.
Thank you very much.
God bless you. Thank you, BJ.
Bye. Bye.